Okay, well the purpose of this video is to do a musculoskeletal exam, and my daughter Gloria is going to be the patient. And so do you want to move your chair just a little bit closer that way I have my book closer to me. There we go. Okay, so we're going to start our examination of the musculoskeletal system with the TMJ, or the temporomandibular joint. And what we're looking for are how the person opens their mouth and closes their mouth, how that joint is working. So you can feel the joint by pressing right in front of the tragus, and you ask the patient to open and close their mouth a couple times. Ask them to sway their lower jaw back and forth. And what you're checking for is any swelling, clicking, crepitus, which would be that sound of the bone against the bone of the joint. So are you having any pain with that? Open really wide? Okay, good. All right, so she doesn't have any pain, no clicking. So that joint is opening and closing really smoothly. So I would say that that is a normal TMJ. The next thing we're going to look at is her cervical spine to see what kind of range of motion she has. So I'm going to ask her to flex and extend her head, and then do some lateral bending of her head and rotating, and we'll see how that works. So go ahead and flex your neck way back. Okay, good. You've got really good range of motion. And then do some lateral bending this way, that way. Very good. Okay. So the thing that we're looking for is limited range of motion, or if she had any pain when she moves. And did you have any pain or anything like that? No, she's got good range. Okay. So, and what we're also looking for is she should be able to extend and flex 55 degrees in both angles, and as far as the lateral bending, she should be able to bend her head 40 degrees in either direction. And then for rotation, you're looking at the ability to rotate your head at least 70 degrees both ways. So she can do that, so that's a good exam on the cervical spine. The next thing we're going to be doing is we're going to be looking at the shoulders, and we'll have her do some flexion and some extension and some internal rotation. But first thing, we're going to just check the shoulders to make sure that they are symmetrical. Why don't you stand up, Gloria? Okay, here we go. So make sure that they're symmetrical and even, and she's not slumping from one side or the other. Looks good and even. And her bony landmarks are, her clavicles are straight, top of the shoulders are straight. And have you had any shoulder pain or stiffness or inability to move your arms around? Okay, so I'm going to have you flex your arms all the way up to the top like that. Actually, yep, just like that. And then bring them back down, and then hyperextend them back like this. Good. She's got very good range of motion, so that's great. And then I'm going to have you internally rotate by just putting your hands in back like that, and that's internal rotation of your shoulder joint. Very good. So the thing that we're looking for here when we examine the shoulders is any redness, which might indicate some inflammation, any quality of her bony landmarks, any atrophy of the muscles. A dislocated shoulder would kind of lose the normal rounded shape and look almost flattened. Swelling from excess fluid, or swelling of the subacromial bursa. And I don't see any swelling on her, so that's a normal exam. And she has no tenderness or pain. That'd be something we'd want to ask. Okay, the next thing we're going to do is look at, let's see, to see if she can abduct and adduct her arms. So abduction would be going this way, away from the body, and then adduction would be coming back down. All right. And then external rotation, not so much this way as now this way, over the shoulders, and back behind. Yep, very good. Okay, now we're going to look at her elbows to see if she has good ability to flex and extend her elbows. And when we look at her elbows, we're going to be checking for any redness or inflammation, any deformities, any type of swelling or any pain at all. You'd always ask your patient if they're having any pain, warmth, or tenderness in that joint. So what we want to do is see if she can flex her elbows. So just go ahead and flex them up and then extend them out. That's good. So that would be a normal exam. And you can check the elbow by putting your thumb in the lateral groove and your index finger and middle fingers to the medial groove, palpate either side of that olecranon process using varying pressure. So normally it says the tissues and the fat pads feel very solid. So you just check for any synovial thickening, swelling, or nodules or tenderness in the elbows. And I don't feel anything like that. Good. Okay. So let's see. Now we're going to test the strength in her arms, the muscle strength. So put your arms up like this, and I'm going to pull away, and you pull toward yourself as hard as you can. Okay, good. Now I'm going to push against you, and you push against me. Good. So she's got some good strength in her arms. And we're going to test her wrists now. You're going to look at her wrists to make sure there's no swelling or tenderness in the joints. And then we're going to test her range of motion to see if she can bend the wrists. So flex, extend. Go ahead and show me that you can do that, and the other one as well. This one too, please. Flex, extend. You're kidding.
Yes.
Only Gloria?
Yep.
But you can see Gloria though, right?
Gloria
you can
is
see
there.
everything that we're doing.
Gloria is there, but you are not in there.
It doesn't
you.
matter. I'm teaching.
Oh, okay. Sorry for that.
I mean, you can't see me at all
At
doing
all,
anything
I
to
can
her.
see only your hand. Only your hand. None of your body is there.
Oh.
And only your hand. The dog is there too, though. Is it okay?
I don't mind if the dog is
Yeah.
there. Yeah. Well, why don't you move it just a little bit so that you get me in there?
You can come and see here.
No, I
and
don't
then
want to
I
come
will
and see
stand
there.
there.
Just move it.
So that I can see both of you.
Yeah.
There.
There. Okay.
Now you are both in there.
Okay. All right.
Yep.
Okay, so we're looking at the wrists, making sure that there's no tenderness, warmth, or redness at the joints, and she said she can move those freely. Okay. So the next thing we're going to do is look at the metacarpal phalangeal joints with our thumbs, and so you just want to check those joints to make sure there's no swelling. Those look good. And then also we're going to be checking the interphalangeal joints, and we're looking for synovial thickening, any signs of arthritis, inflammation, and those look good. So, okay, great. Now I'm going to have you do this with your hands, with your fingers. Extend like this, flat out, and flex them down. Good. And then I want you to be able to do this, like that, which is ulnar deviation. And then go ahead and spread your whole fingers out like that. Okay. And then do this, and then make a fist. Great. Okay. And what we're checking here for is any type of limited motion or pain on movement. Any pain? No? Good. Okay. So now the next thing I want to do is check you for carpal tunnel syndrome, and that is a syndrome where you get numbness, burning, tingling, pain in your wrist and hand because the nerve is being pinched right here in the carpal tunnel. So there's two tests that you can do for this. One is called the Phelan test, and that is where you ask your patient to do this with their wrists and hold them together, and I think it's for about 90 degrees, and acute flexion for 60 seconds. And if they can hold the wrist like that for 60 seconds and they don't get any numbness, burning, tingling, pain in their hands and wrists, then they should be good. So that would be a negative Phelan test for carpal tunnel. And then the other test is the Tinel test, where you actually percuss the location of that medial nerve at the wrist and see if it produces any symptoms in the hand. So I'm just going to percuss that nerve. So any tingling, numbness, burning, anything like that. Okay, good. So that would be a negative Tinel test, so she's negative for carpal tunnel syndrome. Okay, now I'm going to have you lay down on the couch. Move that chair out of the way. And we're going to do some lower extremity testing here. So no. So first we're going to start out with the hips a little bit and see how her hip joints are, and we're going to start out by abducting the hip by raising the leg and adduct. Or actually this is actually flexion. Oh, get down. This is flexion and this is extension. Flexion, extension, okay? And now we're going to try internal and external rotation. Am I in the video?
Yeah.
Okay. So to test whether or not she can externally rotate would be to bend this up, and that's internal rotation of the hip, external rotation of the hip. Very good. External, internal. Very good. So then you would ask your patient if they have any pain or limited movement in their hips, and that was fine. You didn't have any pain or, okay, good. All right, now we're going to do some abduction and adduction. So when you abduct the hip joint, you move your leg away and then move it back and then over there and move it back. Any pain or problems with that? Okay, good. All right, so the next thing we're going to look at are the knees. So I'll have you sit up on the, let's see, I'm going to check your knees for any type of swelling right in here below the kneecaps. And there's no swelling there. There's no bulge. If fluid has collected, sometimes you'll be able to do a test on that. A ballottement of the patella. This test is reliable when large amounts of fluid are present. So you would use your left hand to compress the suprapatellar pouch to move any fluid into the knee joint, and with your right hand push the patella sharply against the femur. If no fluid is present, the patella is already snug against the femur. So I guess I can't do that on you because you're ticklish. Okay. Yeah, that's good. You can sit up now. And you can actually stand up. So I hope that you can stand up. Huh? Oh yeah, go ahead and lay back down. We're gonna also test the strength. Go ahead and do circles with your ankles. Good. So she's got good rotation of the ankle joints. And then I'm going to test the strength of her legs. So I'm going to push against your feet and I want you to push back. Okay, good. And then I'm going to pull and I want you to pull forward. And that's how you can, she's very strong. So she's pushing and pulling really hard against me. Okay, now you can stand up. Okay. Now we're going to do some flexion and extension of the knees while you're standing. So come over here and just raise up your knee, flex, and then extend like this. Good. And then the other one, flex and extend. Very good. Okay. Any problems with that? No. And the thing we're looking for here would be limited range of motion, any contracture, pain with motion, or limping, or her knees locking up. Okay. Let's see. So now I'm going to have you go ahead and lean over and touch your. Well, first I'm going to look at her back and her spine, And I'm going to look at the symmetry of her back. So her shoulders are symmetrical, her scapula are symmetrical, her hips are symmetrical. So now I'm just going to have you lean over and touch your toes. And when she does that, I'm going to be making sure that her scapula and everything is straight and symmetrical, and I don't see any curvatures or signs of scoliosis. So go ahead and stand back up. And let's see. So that is extension and flexion. And then can you do me a favor, Gloria, and just see if you can extend back like that? Okay, good. Whoa, okay, good. That was good. All right. And now I want you to do some lateral bending, both to the, why don't you come out this way just a little bit, and do some lateral bending to the sides, good, and that side, good. Okay, so, and then do some rotation. Can you rotate also? Good, oh my gosh, good, very good. Okay, so she's very agile. That's great. All right. And that pretty much, and then I'm just going to palpate your vertebrae just to make sure that I don't feel any vertebrae that are out of place or anything abnormal all the way down, and everything feels really good. And so that ends the musculoskeletal exam. Thank you.